Rabies, it's existed perhaps since life on Earth began. It's considered by some to be Satan's contribution to Genesis, and it was described 4,000 years ago in the pre-Mosaic Code of Mesopotamia. Homer and Aristotle wrote about it centuries before Christ. A method of treatment was offered in the Babylonian Talmud in 500 A.D. A victim was instructed to drink only from a copper tube, lest he see the shadow of the demon, which of course refers to the hydrophobia. In the early years of America's colonization, the cry "mad dog" sent men scurrying for their weapons. The incubation period is usually several weeks to months, but it can range from days to years. And there are 3 stages of the disease, each with its own symptoms. In the first or early stage, the prodromal stage, there's a high fever, 102 plus, nausea, vomiting, headache, fatigue, loss of appetite, sore throat, a cough, depression, and restlessness. There is pain, tingling, and burning at the site of the exposure. This usually lasts 1 to 4 days and takes them into the encephalitic stage. There's excessive restlessness, uncontrollable excitement, confusion, hallucinations, combativeness, muscle spasm, and the body assumes an arched, prone posture supported by the head and feet. There are seizures and focal paralysis. The fever rises to 105 or higher. The sense of touch is excruciatingly painful. There is hypersensitivity to light and noise, even air disturbances, tears, perspiration, and saliva flow. This is the stage that you would expect an animal to be in if they were attacking in an uncontrollable and excited stage. But it happens to humans as well. In the third stage, the dysfunctional stage, there's a double vision, facial palsies, and a foaming at the mouth. Extreme thirst is common, but swallowing is painful, sometimes impossible. Finally, there's complete paralysis, coma, and death. This last stage may span 4 to 6 days and describes what is called furious rabies, the most frequent type. Occasionally, a victim will suffer dumb rabies, named for the paralysis that affects voice muscles and soon thereafter breathing muscles, causing death. Dumb rabies is noted most frequently, but not exclusively, after rabid bites by vampire bats. In 1884, Louis Pasteur developed a preventive vaccine, and if administered immediately and the dormancy period was long enough, it was usually effective in preventing infection, but otherwise it was useless. On occasion, the vaccine itself caused a fatal anaphylactic reaction. Prior to the 1970s, a diagnosis of rabies invariably meant certain death. In 1968, Dr. Victor Cabasso began experiments with a new prophylaxis and succeeded 4 years later. This involves the injection of previously developed rabies antibodies. I worked for Cutter Labs when rabies immune globulin was introduced, and I can still well remember the midnight telephone calls to various state police departments arranging for a 10 ml vial or whatever was needed to be picked up by state police in one of the city's larger medical centers and delivered to some small rural hospital, sometimes from Portland, Maine to the Canadian border on Fort Kent, and I remember it well. It was an incredibly innovative product at the time. If post-exposure prophylaxis is not initiated before the onset of symptoms, death is almost always imminent. There is no treatment for diagnosed rabies. 6 cases of survival of human rabies have been documented in individuals since 2006 who had been previously vaccinated or received post-exposure prophylaxis. The survival of I think she was a 14-year-old girl from Wisconsin, received substantial attention in October 2004 as the first case of human survival of rabies in the absence of preceding vaccination or post-exposure prophylaxis. She had neither, and she is the only case on record to survive. In 1953, 6,200 domestic animals were diagnosed with rabies. 53 years later, in 2006, that number dropped to 547, largely due to our domestic animal vaccination programs. Of 6,943 cases reported in 2006, 92% were in wild animals. Every year, From 20 to 40,000 people received post-exposure prophylaxis. From 1946 to 1960, there were an average of 22 human cases per year. Since then, there's been a high of 6 per year to a low of 0. From 1990 to 2004, there were 47 human cases recorded, and 4 of those were due to organ transplants. Unfortunately, about 55,000 people die of rabies every year, but most of them in Asia and Africa. All warm-blooded mammals are susceptible. In 2006, there were 6,388 wild animal cases. Raccoons are the worst, 38%. Bats, 24%. Skunks, 22%. Foxes, 6%. And other, 2%, including 66 mongoose in Puerto Rico, 43 groundhogs, 30 bobcats, 10 coyotes, 6 deer, 4 otters, 2 opossums, and 1 each rabbit, cougar, wolf hybrid, and fisher. Transmission is usually by a bite wound, but the lick of an infected, though not necessarily symptomatic animal, on a scratch, abrasion, open wound, or mucous membrane tissue of the eyes, mouth, or genitals can transmit the virus. Transmission through the air via respiratory tract is now also known possible, and it has occurred in the Bat Caves of Texas. In 1993, New York confirmed rabies in 20 deer. The year before, they only had 5, and the year before that, only 3. Between 1992 and 2001, New York also confirmed rabies in 7 rabbits. In 2006, 49 states, Puerto Rico, and D.C. reported rabies-infected animals. Only Hawaii remains consistently rabies-free. The rationale for treatment depends on the answers to 4 questions. Has the animal's saliva entered the subject's body? If not, there's little risk. What was the vaccination status of the animal? If it was vaccinated, there's little risk. But if the animal's behavior is abnormal, get professional advice. Is the animal likely to be rabid? Carnivorous animals and bats are more likely to be rabid than non-carnivorous animals. Was the animal provoked? Most wild animals avoid human contact, so one that bites should be considered rabid. A normally friendly domestic animal that bites without provocation should also be considered suspect. The new CDC Advisory Committee on Immunization Practice recommendation, which came out just a week or so ago, June 24th, 2009, is to administer rabies immune globulin at 20 international units per kilogram of body weight, plus 4 rather than 5 shots of vaccine. It had always been 5. They changed that on June 24th. Now the protocol is rabies immune globulin and 4 rather than 5 shots of vaccine on days 0, 3, 7, and 14. Treatment also depends on whether there was pre-exposure prophylaxis. Protective measures: everyone should take maximum safety precautions when handling dead or dying animals. Wear gloves. Avoid contact with saliva. Leave even the cute, young, and apparently defenseless wild animals in their natural environment. So often, hikers or hunters will see a young raccoon or a young deer or a young skunk, although that wouldn't excite me much. And they want to take these little cunning animals home to their kids, thinking that this animal has been abandoned, when in fact it may not have been abandoned. Its mother may have died of rabies, and that mother did what mothers always do. They were licking that young one in the eyes and all over. If the mother had rabies, there's a really strong chance that young baby has rabies as well. So it's best to leave them where they are. Vaccination for domestic animals, of course, is imperative. And that pretty much covers rabies, unless somebody has some questions.